Good morning, and welcome to the Hawaii Health Data Warehouse Coffee Break Monthly webinar series. My name is Tanya Lowry St. John with the Hawaii Health Data Warehouse, or HHDW, in the Office of Public Health Studies at the University of Hawaii at Manoa. We're going to use the next 30 minutes to talk about Claritas consumer profiles and spending data in hawaiihealthmatters.org. Let's get started. Today, we're going to talk about a new collection of health indicators in hawaiihealthmatters.org, or HHM. This data comes from Claritas. Claritas is a nationwide market research group that uses patented technology to combine data from different sources like surveys and census data to create detailed indicators of population demographics, consumer behavior, and expenditures. Claritas data can help users highlight population characteristics of their communities. We've added two Claritas data sets to HHM: consumer profiles and consumer expenditures. These are data sets that are traditionally used by industry for marketing, but we're repurposing them for public health. Let's take a closer look. Claritas consumer profile data indicators can provide a broader understanding of community behaviors across a variety of categories, allowing for more effective health policy, marketing, and program strategies. These indicators can identify communities that are more likely or less likely or as likely as other communities to engage in various behaviors for more targeted strategies. This data comes from the Nielsen Scarborough USA Plus annual survey, and then the data is extrapolated out to give estimates for state, county, census places, or cities. We have data from 2020 to 2022, and the metrics include estimated adult population or household count and percent of total adult population or households, depending on the indicator in each geography. We have 47 consumer profile indicators in the system, and they're pretty wide ranging. You'll find a link of the full list of indicators in the release notes on the video, but you can see the information here. They include types of medical services received by any member of the household in the past 3 years, types of medication purchases in the past year among adults, detailed insurance information type, access to health information technology, economic information, nutrition and healthy eating, weight status, and wellness and lifestyle information. Let's go back and look at two of the indicators to see how they function. We'll start with cardiology medical services. So this indicator is our standard indicator report, and it's households that received cardiology medical services. I'm going to start here looking at the state data. So you can see you can change the data by location here whenever you see a down arrow, and also by year. We're at 2022. And then the next line is going to be the definition. So this is the percentage of households with at least one person who received cardiology medical services in the past 3 years. This is a little information about why that's important. You can see we're at the state rate, and it's 12.3% of all households. The data source is Claritas Consumer Profiles, and then we have the measurement period. This indicator is maintained by Conduent, and then it was last updated in December 2022. We use a series of icons to help you interpret this data and keep it in context. So the US value is 11.8%, and the prior value was 11.7%. By hovering over, you can get a little information about those values and how to interpret them. You can also always access our C legend here on the side, which gives you information about our icons and the colors. As you may remember, if you've seen our system before, red is bad, green is good, and blue is not statistically significant or neutral. So for a variable like this of households who receive cardiology medical services, we are higher than the national value, but we're neutral as to whether that's good or bad. It could be that we have better access to services, or it could be that we have a lot more people who need cardiology services. You need to do some more research to put that into context. So scrolling down in here, you can see that the data is available at the county, census place city, zip code, and census tract level. I'm going to take a look at another one of the variables that we have in the system from the Claritas consumer profiles, and that's going to be adults who visited a cardiologist. I can scroll down here and see if it's here in the related content, and we'll see that there's a lot of related content for this indicator and all of our indicators. When you have indicators, reports, data resources, plans, websites, fact sheets. So here's the state heart disease and stroke plan, for example. I'm not seeing it quickly here. I could click on more, but here I'm going to show you a trick. I can just click on the box here and start to type in my word. And I'm just going for cardiology, and I see it's adults who visited a cardiologist. So I'm going to go ahead and click on that indicator. And then now I see this is adults who visited a cardiologist in the state of Hawaii for 2022. And the indicator is the percentage of adults who visited a cardiologist in the past year. So again, here's my why it's important. And I see that it's 14.2%. You may see that that's a little higher than the whole households, which is 12.3. So it makes sense. Adults that saw a cardiologist may have lived in the same household together. Again, we have our comparison values for the US and the prior values and change over time. On this indicator, I just want to show you, let's take a look at a more granular location, the census places or cities. This is not a geography that we've covered much in some of the previous webinars, so I wanted to cover that one today. So the census places or cities are locations that are developed by the US Census into place values, and Hawaii is divided up into 151 census places, and so that might be helpful for you when you're trying to define your community. Looking about adults who visited a cardiologist, the lowest value by place is 6.2%, and the highest is 27.8. And then we have information about the half of the values between 12.8 and 17.6%, and the median. If you want to download this data, you can always click here, and there's several download places throughout the website. Here you can see that these three different display panels are interactive. So if I hover on one, the corresponding box and location appears. And if I do on the chart, it appears in the map and the table. And if I do in the table, it appears in the map and the chart so that you can sort of work with these interactively. So this is just a quick standard report from this. So going back, our next source of data is our Claritas community expenditure data. And it provides neighborhood level insights into consumer expenditures that may impact health outcomes. This data comes from the Claritas Consumer Spending Dynamics database, or the CSDX database. CSDX dataset includes household spending estimates of 678 products and services in 14 different categories. And this dataset was developed using the consumer expenditure surveys conducted by the Bureau of Labor Statistics as a base, and then combined with their proprietary software for creating local area estimates. The data is available for state, county, zip code, and census tracts, and the time period is currently limited to 2022, but it will be updated annually. There are two types of indicators from this data source. One is the expenditure to income ratio, which is the ratio between the average spending among the households that spent on the category and the median household income for the region. And these indicators can help show the potential impact of spending in each category in relation to overall income. There's also the community expenditures, and that's the proportion of aggregate household spending on a category as a percentage of the total aggregate household expenditures for the region. These indicators can help show how communities are allocating financial resources for each category. There are 17 consumer expenditure data indicators in the system, and a link to the custom dashboard for the indicators can be found in the video notes. They're also briefly listed here. There's 5 community expenditure indicators, and these have breakouts available within these spending categories, and there are 12 expenditure to income ratio indicators. So let's take a look at this healthcare and health insurance indicators and explore how they can help us better understand our communities. So this is the indicator for community expenditures on healthcare. You can see that you can change the geography, but right now there's only 1 year of data. And the definition is this shows all household spending on healthcare as a percentage of all the annual household expenditures in the selected location. So they are location specific. And this includes spending on, when they talk about healthcare, it's spending on health insurance, medical services, medication, vitamins, and medical supplies. So here for the state of Hawaii in 2022, there's our measurement period. According to the Claritas Consumer Spending Dynamics data source, 7.6% of all household expenditures are spent on healthcare services. And if you want to divide those 7.6% up into like a pie chart, this is kind of helpful for me to think of this one as a pie chart. Of those healthcare expenditures, 8.8% are on drugs and vitamins, 72.6% is on health insurance, 15.3% is on medical services, and 3.3% is on medical supplies. So of our 7.6% of all household expenditures that are on health care, the vast majority is on health insurance. Again, I can go in and dig down into these different geographies to find out more specific information about my community. We also have an ability to view this information by subgroup. However, these subgroup categories were created for the mainland clientele and may not be that relevant here for Hawaii, but they do exist. So scrolling down here again, you can see that we have the data source information, more information about the methodology, and then related indicators and reports to this. And in this case, I'm going to click on the health insurance expenditure to income ratio, knowing that the vast majority of healthcare expenses in the state are on health insurance. So here you can see the definition of this indicator. So it's the ratio between the average spending on health insurance among households that spent on health insurance and the median household income in that selected location. And here we have a more in-depth definition of what we're defining as health insurance for this indicator. And so that we can see that overall in the state of Hawaii, the average household spent 5.4% of all of their income on health insurance. Again, we have in this case our race ethnicity breakdown, and then we can go in and we can look again more closely at our different geographies if we wish. But if we want to think about this, and again, compared to the United States, we actually spend much less than most folks on health insurance. But what is 5.4% of the median income? We also have median income data in the system. So we can come up here and start typing in median household income and click on that. And you can see then that for Hawaii, the median household income is $83,173. So we can do a little math and figure out that if our health insurance expenditure to income ratio is 5.4% and the median household income is $83,173, that the average household spending on health insurance in Hawaii is probably about 4,000. I would say about $200. I would kind of round this up myself, but that helps you get some real ideas of what this means in real dollar amounts when we're talking about that expenditure to income ratio and how you can be using that information to help inform your programs. Let's go and navigate to hawaiihealthmatters.org and do some exploring. To get to hawaiihealthmatters.org, you can use either of the indicator list that we have provided as part of this webinar. You can also go to hhdw.org and click on hawaiihealthmatters.org, or you can type hawaiihealthmatters.org into your browser. This will bring you to our main web page, and here you can find a video that gives you a lot more information, more in depth on this website, its features, and how to use it. But today we're going to focus on finding this Claritas information. So we're going to go to Find Data and Community Dashboard. Here you can find a link to our video for last month on how to do your own advanced dashboard. But we're going to come here to Advanced Search, and we're going to filter by our location being the state of Hawaii. And our data source, we're just going to go ahead and type in Claritas or just start, and I'm going to click on both of these. And this will create a quick custom dashboard of all of the Claritas data profiles that we have here in the state. So you can go ahead and scroll down, and again, you can look at each indicator, the point estimate, and its comparison group. We compared here to the state of Hawaii. That's our geography that's selected. I can scroll all the way down. I can click up on this little arrow here to bring me back up to the top. And let's say I instead want to look at Maui County. So I'll go ahead and resubmit my query and still have my comparisons. This is the value for Maui County. It's compared to the Hawaii value, then the US value, prior value. This one actually happens to have a target in the state cancer plan as well. So you can see that you can change things as you go along. Scrolling down here, let's say I'm in Maui and I'm really interested in putting on some programs that are going to be internet based, and I want to see if that's going to work. So I can take a quick look here and I can see about adults with internet access here in Maui County, and I can go ahead and click on that to find out exactly how that's defined. And I can see that it's adults who have internet access through computers, tablets, smartphones, or other mobile devices, either at work or at home or elsewhere. And I can see that the number is pretty high. It's 96.7%. But I can use the strategies we talked about before to try to look into Maui County deeper, either looking at it by census place, zip code, or census tracts. I can also just go back and look at some of the other context information regarding health information technology access in Maui County. And I can see that there's a lot of folks with internet access. Fewer have a computer at home in their household, and even fewer with smartphones. Wireless cell phone service is prevalent, but only about a third of adults access medical services information through the internet. So if I was going to program around this, I would want to dig in deeper and figure out who's accessing where, and would want to account for this in either how I advertise my program or how I design my program or ways that I would go to sort of address this barrier. So this is one way to use the data. So now I'm going to invite you to do a little activity to get your hands on the data yourself. So I have two questions for you to answer. The first regards student loans, and it's what percentage of households in Kauai have student loan debt? And what is the student loan expenditure to income ratio in Kauai? Then, using the trick we showed about finding median household income, what is the median household income in Kauai? And so we can do a little multiplication there and find out on average how much do households with student loan debt in Kauai spend on loans each year. And my next question is regarding mental health. What percent of households in the state and county received mental health care medical services in the past 3 years? And then what percent of adults, state and county, bought medications for anxiety or depression in the past 12 months? The first question is what percent of households in Kauai have student loan debt? So we're already here on this previous one that we created. So I can either search this option or I can also come up here and use the search feature. There's a bunch of different ways to find the data in the system. So I will go ahead and search here as well. This search box gives you both indicators and promising practices and reports and so forth. So here I can see households with student loan debt. So I can go ahead and click on that one. And I'm interested in the data by county. And I can see households with student loan debts. And here for Kauai, it's 8.5%. And if I wanted to see what it is for the state, I can click on a comparison value and see that state overall it's 10.3%. Scrolling down, I want to say what is the student loan expenditure to income ratio in Kauai? So I have a feeling that's going to be a related indicator, and sure it is. It's right here. So I'm going to go ahead and click on this one. In looking at the county level data, and I can see that the student expenditure to income ratio for Kauai is 4.5%. So now I can do some fun math here and say what's the median household income in Kauai. So I'm just going to do median household income. And I'm still here at this information. So I can see here in Kauai, it's 82,881. Then I can do a little bit of quick math here, and you can multiply that number times the student to income ratio, and you get the idea that it's about $3,700, a little over $3,700 a year is what the households with student debt spend on those loans every year. Going back to the next question regarding mental health, I'm going to go ahead and use this search box. And so I can say mental health, and it's going to be households that received mental health care services. So what percent of households in the state and county received mental health care services? And here, since I had been looking at by county, the county data is available. I can click here to add the state data. So for the state, it's 7.5%, and it ranges from 5.7% in Hawaii County all the way to 8.1% in Honolulu County. And then I can also go through, and the next question is what percent of adults in the state and county bought medications for anxiety or depression in the past 12 months? So I'm going to scroll down here and see, yep, it happens to be a related indicator. So I'll click here. I will look at the county level data and just do that trick to do the state comparison so I can have it all in one place. And I can see that for the state, it's 13.7%, and it ranges from 13.1 in Honolulu County all the way up to 14.9 in Maui County. Thank you for joining us today, and remind you that we have these webinars on the first Tuesday of every month. So please join us next month on March 7th at 11 a.m. where we'll be reviewing the 2021 birth record data and how to build your own birth record report in HHDW. And in April, we'll be featuring the 2021 death record data. And also to remind you to please consider liking us or following us on Facebook or Instagram or our YouTube channel.